General Scheme Cardiology. 1. Definition. 1. Heart failure, HF. Definition: a complex clinical syndrome due to structural or functional cardiac abnormality leading to impaired ventricular filling or ejection of blood, causing inadequate tissue perfusion and/or elevated intracardiac pressures at rest or during stress. EBM note: diagnosis equals clinical plus objective evidence, echo, plus or minus natriuretic peptides. Classification by EF: HF-REF less than 40%, HF-MREF 40 to 49%, HF-PEF greater than or equal to 50%. ACC-AHA stages: A to D, risk to refractory. 2. Ischemic heart disease, IHD. Definition: a group of syndromes caused by myocardial ischemia due to an imbalance between myocardial oxygen supply and demand, most often from atherosclerotic coronary artery disease. Clinical forms: stable angina, unstable angina, NSTEMI, STEMI, silent ischemia, ischemic cardiomyopathy, sudden cardiac death. 3. Hypertension, HTN. Definition: a sustained elevation of systolic BP greater than 140 mm Hg and/or diastolic BP greater than 90 mm Hg on 2 occasions measured under standardized conditions. 2024 EBM note: some guidelines AHA and ACC use greater than or equal to 130 by 80 mm Hg for diagnosis in high-risk patients. Categories: AHA 2017, normal, less than 120 by 80. Elevated, 120 to 129, less than 80. Stage 1 hypertension, 130 to 139, 80, 89. Stage 2 hypertension, greater than or equal to 140, greater than or equal to 90. 2. Etiology enumerations. Heart failure, IHD, most common worldwide cause of HF-REF. Systemic hypertension, most common cause of HF-PEF. Valvular heart diseases, cardiomyopathies, dilated, hypertrophic, restrictive, myocarditis, arrhythmias, pericardial diseases, high output states, thyrotoxicosis, anemia, beriberi, infiltrative diseases, amyloidosis, sarcoidosis. IHD, atherosclerosis, 90 to 95%, coronary spasm, Prince-Metal's angina, embolism, endocarditis, prosthetic valve thrombus, dissection, spontaneous or iatrogenic, congenital anomalies, myocardial bridging, vasculitis, Kawasaki, PAN. Hypertension, primary, essential, 90 to 95%, multifactorial, secondary, 5 to 10%, renal, parenchymal, renovascular, endocrine, pheochromocytoma, Cushing's, hyperaldosteronism, thyroid disorders, vascular, coarctation vasculitis, neurological, increased ICP, drugs, NSAIDs, steroids, oral contraceptives. 3. Clinical picture. I. Manifestations of low cardiac output, LCOP, 7 items. Due to hypoperfusion of 1. CNS, dizziness, headache, syncope. 2. CVS, angina, ischemic heart disease. 3. Kidney, oliguria. 4. Skin, cold extremities, peripheral cyanosis. 5. Skeletal muscle, fatigue, intermittent claudication. 6. BP, low systolic BP. 7. Pulse, weak, thready. I. Manifestations of lung congestion, left-sided disease, 7 items. 1. Dyspnea, exertional, orthopnea, PND, rest. 2. Exertional cough. 3. Recurrent chest infections. 4. Hemoptysis, pink frothy sputum in pulmonary edema. 5. Pleural effusion. 6. Pulmonary edema. 7. Bilateral basal crepitations. II. Manifestations of systemic congestion, right-sided disease. 7 items. 1. Insomnia. 2. Sweating on slight activity. 3. Jugular venous distension. 4. Lower limb edema, ascites. 5. Hepatomegaly, soft, tender. 6. GIT, dyspepsia, anorexia, nausea. 7. Pleural effusion. IV, chest pain, 7 descriptors. 1. Site, retrosternal plus or minus diffuse. 2. Character, constricting, heavy, pressure-like. 3. Radiation, left arm, jaw, epigastrium, back. 4. Duration, seconds, non-cardiac, versus minutes, angina, versus more than 20 minutes, MI. 5. Precipitating factors, exertion, cold, meals, stress. 6. Relieving factors, rest, nitrates, except MI, partial. 7. Associated symptoms, sweating, nausea, palpitations. V. Palpitations. Awareness of heartbeat may be rapid, irregular, skipped beats. Causes, arrhythmias, hyperthyroidism, anemia, anxiety. VI. Pressure manifestations. Due to compression from left atrial enlargement, trachea, dyspnea, cough, esophagus, dysphagia, left recurrent laryngeal nerve, hoarseness. Pericardial effusion, compressive symptoms. Aortic aneurysm, similar mass effects. IVI, embolization manifestations, sudden monocular blindness, retinal artery occlusion, hemiplegia, cerebral infarct. Acute limb ischemia. 4. Investigations, 6 core items. 1. Chest X-ray, chamber enlargement, pulmonary congestion, left-sided heart failure, pleural effusion. 2. ECG, chamber enlargement, arrhythmias, ischemia. 3. Echocardiogram, chamber enlargement, wall motion abnormalities, valve disease, paradoxical motion, post-MI. 4. Cardiac catheterization, hemodynamic assessment, coronary anatomy. 5. Other imaging, radionuclide, CT, MRI as indicated. 6. Laboratory tests, CBC, lipid profile, glucose, renal, liver function. MI, cardiac enzymes, troponin, CKMB. Infective endocarditis, blood cultures, pulmonary embolism, CTPA, pulmonary angiography, D-dimer. Cardiomyopathy, endomyocardial biopsy. 5. Treatment. 1. Treat the underlying cause. For example, CAD, revascularization, valve disease, surgery. 2. Treat precipitating factors. Hyperlipidemia, statins, 20 to 80 milligrams daily, monitor for myositis. Fenofibrate, 300 milligrams daily. Omega-3 fatty acids. 3. Specific therapy, depends on condition. For example, HF, ACI, beta blocker, diuretics, MRA, device therapy. IHD, antianginals, antiplatelets, revascularization. HTN, lifestyle plus or minus drug therapy based on stage or risk. EBM and clinical insight pearls. In elderly HFpF patients, treat comorbidities aggressively. HTN, AF. BNP, rule out if less than 100 pg per milliliter, NPV, 90%. Rule in if greater than 500 pg per milliliter, PPV, 90%. In acute chest pain, always rule out ACS before attributing to musculoskeletal or GI causes. Hypertension control reduces stroke risk by approximately 40% and heart failure risk by approximately 50%.